Senator from Oklahoma.
I wanted to spend a little bit of time offering a viewpoint different than the chairman of the committee on this bill. First of all, I want to say by context, my father and his two brothers all served in World War II. My two brothers served during the Vietnam era. There is no question we have an obligation to meet our commitments to those that have put their life and future on the line for this country. But it pains me that although we've increased spending 58% in the VA program since 2009, which is fiscal 2010, what we have seen is a complete lack of oversight of what's happening. And let me give you an example. The VA committee in the Senate last year held 30 hearings, 4 of which were oversight. If you read the transcripts of those hearings, you cannot call them oversight hearings, even though they were billed as oversight hearings. And why is that important? It's important because there's a multitude of significant, serious problems in the Veterans Administration. Just 2 days ago, it's discovered that in an LA VA clinic, the staff in the clinic destroyed the medical records of thousands of people so that when they do the metric on how far behind, we can't measure it. Or the fact that 82 veterans last year died of carcinomas through delayed diagnosis because they couldn't get a diagnostic procedure like a colonoscopy. Or the fact that we have all these veterans that cannot access mental health care, and we see the suicide rate unacceptable, to say the least. So we have a bill on the floor that massively, and that is a small word for what this bill does, massively expands the authority and the ability of the VA to offer care to another 14 million, veterans. From 6 million to 20 million. On a system today that can't keep up, we have 600,000 people waiting for a disability determination. We're not having oversight hearings on that. We're not having oversight hearings on South Carolina VA Hospital where people are dying through malpractice like crazy. We're not having the oversight hearings to hold the VA accountable. What we're doing is putting a bill to expand their responsibilities instead of holding them accountable for the responsibilities they have today. That's what we should be doing. And instead, we're going to add $60 billion. That's a conservative number. That's my number. But all you have to do is look at what the cost and the efficiency and the outcomes are through the VA system to see. We're going to diminish the Veterans Caregiver Program by expanding it to everybody. We're going to create all sorts of new programs and no resources to actually provide it. And we're going to create more advanced funding, advanced appropriations, which will limit our ability to hold them capable and culpable in the future. There's a lot of things we ought to be doing for our veterans right now that's already in law that we're not doing. And we come to the floor with a massive expansion at a time when we can't even care for what we're doing. And as a physician who trained in VA hospitals, I know the difference in the level of care. And I can assure you it's not gotten any better. And from my colleagues I speak to in the medical profession, and from the veterans that I talk to that contact me, it's gotten far worse. It doesn't have to be that way. But it'll always be that way if, in fact, we continue to not hold those in leadership positions accountable for not stepping up to the bar of performance, quality, and outcome. From Congress to the Pentagon, we must reassess what laws, regulations, and rules can be changed to ensure that benefits and other decisions Veterans Affairs makes are beyond reproach and based on the best facts available. Let's ensure that the department's limited resources are focused on its core mission rather than dispersed in an effort to remedy every possible problem for every veteran. Remember, when everyone is first priority, no one is. That's what this bill is. We diminish the priority of the commitments that we have made to the veterans that are out there today. Our veterans are looking for us for help. We're about to enact legislation that's going to further strain the ability of the VA to do their most basic charge: help with the health care, mental health, and capability of those that have put it all on the line for this country. It's shameful that Congress now is trying to claim credit for providing new benefits while our old promises are forgotten. And our heroes are literally dying at the hands of malpractice, incompetency, and delay. If we really wanted to care for our veterans, those with service-connected disabilities, what we'd say is go wherever you want to go to get whatever you need because you serve this country. And it actually would cost less. But because we pile them into a broken system now, and that's not all VA organizations, let me clarify that. There are some excellent VA hospitals that do great work. They're specialists, they're far ahead of the private sector. But on general grounds, to put a veteran at a place less than the best possible care dishonors their service to this country, dishonors their service to our country. Veterans are our heroes. They're the symbol of our country of sacrifice, of giving for others. And yet we have 4 oversight hearings in a year with a multitude of problems that are going on in the VA hospitals and the VA administration in terms of disability determination. We have 4. The House had 34 oversight hearings, and they were rigorous. When you ask members of the committee, have you read the House oversight hearings? No. So they had 26 regular hearings and 34 oversight hearings trying to hold the VA accountable. We're not going to hold the VA accountable with this bill. We're going to make them less accountable. And that's a disservice to the very people that honored us by serving in the military of this country. As of February 15, 2014, the VA has 677,000 claims pending for disability compensation. Why should it take a year for somebody who put their butt on their line for this country and received an injury and is disabled for it? Why should it take a year for us to determine that we owe them an extra bit of compensation and availability? What's being done to fix that? We have a VA regional center in my hometown. Good employees. Hard-working employees. They're not destroying files so they can say they met a metric. Veterans seeking mental health treatment still experience weeks-long delays scheduling appointments, and the epidemic of overprescription of opiates. Let me say that again. There's an epidemic of overprescription of opiates for those people who served our country, making them dependent addicts because we give them the wrong treatments. There's avoidable veterans' deaths at the VA. Recent story by CNN, misdiagnosis and improper care of just gastrointestinal conditions, 2-year consultation delays. 2 years? To get in to see a specialist at the VA when you're losing blood? How do we explain that? Who's accountable? We are, because we're not holding them accountable. 82 deaths last year alone, and I'm sure that's a far understatement, because of delayed diagnosis for just investigative endoscopies. That's just what's documented. How do we accept that? Because had they been in the private system, they wouldn't have had a delay. They wouldn't be dead. So here's the proposal that I would put out. Do our veterans deserve the best of care in this country? I think they do. Should they be able to get that care where they know the quality, they know the outcomes, and they know transparency as to what their future might be? Or must they be forced into a system that's going to give them something less than that? Because that's where we are today. The chairman, in his mark, increases VA medical care for everybody that served without a disability. What will that do to the VA system? We can't handle what we have in front of us now in terms of those that have a percentage medical disability that allows them access to the VA healthcare system. So when you triple that, or more than triple it, where are the resources? And if we really mean what we say in this bill, you're talking hundreds of billions of dollars over 10 years. You're not talking the $30 billion that the chairman says is what the cost is. You're talking hundreds of billions. But the point I would make is we have an infrastructure out there that can care for our veterans. It's the hospitals all around the country. It's the doctors all around the country. Has a veteran not deserved the right to get the best care? Should we not give them a card and say, you serve this country. Here's your service connection. Here's your disability. You can get care at a VA hospital if you want, or you can get a care wherever you want. But I'll guarantee you what will happen is if we give what was promised to the veterans, not what we're giving today, real care, real opportunity with real transparency as to outcome, what you'll see is marked improvement in care, marked improvement in outcomes, no change in additional cost, no change in additional cost, and access that's promised but not denied and delayed. In one South Carolina VA facility alone, 20 veterans are either dead or dying of cancer because of delayed diagnosis. Had the symptoms, presented to the hospital, but because of delay and incompetency, just that one hospital. The other thing we know is veterans' malpractice claims are markedly increasing. Markedly. All you have to do is look at the OIG report on the claims of deficiencies at the VA at New Haven, Connecticut. Contamination, cross-contamination, inadequate procedures for infection precautions, absence of employees that are supposed to be on duty when they're not, failure to clean operating rooms properly, failure to have the proper ventilation system in an operating room for a contaminated case. That's just one hospital. What does that mean in real life? What that means in real life is the risk for an iatrogenic or facility or physician-caused infection goes through the roof. Not the fault of the physician, the fault of the VA for not managing the system properly. Former VA epidemiologist Dr. Stephen Coughlin testified before the House Veterans Health Affairs Committee that the VA failed to follow up on over 2,000 veterans who indicated in VA surveys that they were experiencing suicidal thoughts. When the HVAC followed up Dr. Coughlin's claims, they found that they were validated. And unfortunately, too many of those who had suggested their problems committed suicide. It's a little late. Because Dr. Coughlin brought this up, he was admonished, bullied, and intimidated for speaking about the ethical lapses at the VA. Where's the oversight hearing on that? Here. You see, if we're not going to hold the VA accountable, the quality of care isn't going to rise to the level that our veterans deserve. Other areas, the VA wasted $3 billion over the past 10 years because they failed to secure competitive market prices for surgical implants. That's $3 billion. That's documented. It's a GAO study showing it. GAO did that. We didn't do it. We didn't find it. And oh, by the way, at the end of the year, when they had some money to spend, they bought $600,000 worth of artwork instead of put it into additional doctors cleaning operating rooms, additional people to secure clearances on disability. One of the things, by expanding VA care to the potential of 22 million veterans, is that you can guarantee that the veterans are getting care now are going to get poor quality and less access to care. You can guarantee that. So that's what this bill is really about. This bill is really about a decrease in the requirements for care for our veterans. It's not about an increase, it's about a decrease. Because when you flood that system with people who do not have a service-connected disability, what will happen is easy goes first, hard goes last. I've seen it in the VA my whole life. There's also an expansion in the caregivers program. I'm not sure I disagree with it, but certainly for those after 9/11, the commitment ought to not be diminished if we expand this program. The minimum cost for that's $9.5 billion. And VA has not yet met its full obligation under the VA caregivers law that we have today. Yet we're not holding them accountable for that. There's another area of this bill that I think is tragic. It's well-intended, but to mandate that the University of West Virginia, or the University of Oklahoma must give in-state tuition to anybody from anywhere that's ever served, or they lose their benefits under the GI Bill, totally ignores the Constitution in this country. Now, 20 states have already said they're doing that. 10 others have bills in the process. 8 others have a partial. So we're at 38 of the 50 states right now. But in our vision, we're going to mandate that the 10th Amendment doesn't mean anything, that the 80% of funding on higher education in Oklahoma that comes from people in the state of Oklahoma, we can co-opt that and coerce them and tell them what they're going to do. It's well intended, but it's certainly not constitutional. And it certainly doesn't respect the 10th Amendment of the United States. Does Oklahoma or West Virginia have the right to make a decision on who they give in-state tuition? Why not just pass a law that says every state will give in-state tuition to everybody? The reason it was connected with state because of state funding. We totally trample that. And again, the advanced appropriations will limit our ability to hold those people accountable for the very things that I've described here. But we're going to do it anyway. A proposal to expand VA advanced appropriation needs to be considered by the administration as a part of an across-the-government review of the advantages and disadvantages of such approach, not only for the VA, but potentially other programs and agencies. Only in the context of such a broad review could the administration offer an opinion on making such a change for VA. Therefore, we cannot offer a position. That's from the VA. The real answer is give us advanced appropriations, and then it's only after the fact can you hold us accountable, not during the fact. Here's another GAO study that we should be highly concerned about. The VA, this is the GAO, has no idea how long most patients wait to receive care. They don't even know their own metrics. It's unclear how long veterans are waiting to receive care in VA's medical facilities because the reported data are unreliable. Because VA hospitals have tried to cover up wait times, fudge numbers, and backdate delayed appointments in an effort to make things better than they are. That's directly from a GAO report. Where's the oversight hearing on that? Or the LA that just destroyed medical records, says nobody could know how long people have been waiting for appointments. Based on GAO recommendations to improve reliability of reported wait times for new medical appointments in 2013, the VA changed the way it tracks and calculates its performances. Using the new trafficking method in 2013, the VA reported only 41% of veterans were scheduled for a new primary care appointment, and only 40% of veterans were scheduled for a new specialty appointment within the 14-day standard. So 40% of the time, with the 6 million veterans we have now, are getting adequate, timely care. 60% are not, and we're going to expand that to 22 million. And we don't have the resource base, or the facility base, or the employee base, or the professional base, or the caregiver base to do that. In contrast, the 2012 VA reported that 90% of new primary appointments and 95% of specialty had met the 14-day standard. The VA exam request backlog purge. VA employees destroy veterans' medical records to cancel backlog exam requests. That's from Patrick Howley, again. Oliver Mitchell, a Marine veteran and former patient services assistant at the Los Angeles VA system, told the Daily Caller, "We just didn't have the resources to conduct all those exams. Basically, we would get 3,000 requests a month for medical exams, but in a 30-day period, we only had the resources to do about 800. That's 25 a day. That rolls over to the next month and creates a backlog. It's a numbers thing. The waiting list counts against the hospital's efficiency. The longer the veteran waits for an exam, that counts against the hospital as far as productivity is concerned. Some patients were waiting 6 to 9 months for an exam, and the VA didn't know how to address the issue. Is the answer to open this up to another 16 million veterans? Or is the answer to improve the efficiency, transparency, quality, and outcomes of the present VA system before we go about expanding this system to people who are otherwise covered? Mr. Mitchell, when he tried to sound the alarm on the VA's deliberate attempt to fraudulently reduce the backlog, he was transferred out of his department and eventually terminated from his job. After he contacted Congress in 2011, 2 months later, when the VA found out about it, he was fired. So do we really want transparency in what we're doing? Do we really want to know what's going on? Do we really want to fix the system? Do we really want to offer health care to veterans and make it equal to what they can get in the private sector? Or do we want to say we want to offer all these new benefits at the same time we're not meeting our commitment on the benefits that we've already promised? That's a game that's being played. And earlier I said the VA Senate Committee on Veterans Affairs held 30 hearings. They only held 16. 16 hearings, one every 3 weeks. The annual budget of the Department of Veterans Affairs exceeds $134 billion a year. Delays in vet care is not for the lack of money. The delays in vet care is not for the lack of money. It's for the lack of accountability management. Case in point, more than 20 veterans are died or dying due to late diagnosis and treatment of cancer at the Williams Jennings Bryan Dorn Veterans Medical Center in Columbia, South Carolina. Documents show that only a third of that $1 million appropriated by Congress to fix the problem was used for its intended purpose at that VA facility. Only a third of the money that we appropriated to fix this problem was actually used for it, to pay for care for veterans on waiting lists. At the same time, the documents show the waiting list at Dorn kept growing to 3,800 patients in December of 2011. Mr. President, I'll be back to speak on the floor and offer amendments. I have pages and pages of examples of veterans who served this country honorably, proudly, and sacrificed to a great extent, who are getting substandard care in the system that we are offering them today. Before we expand that system, what is needed is a rigorous oversight and debate about how we're doing what we're doing now. The promise of access to care by our veterans, to our veterans, as shown from VA centers, clinics all across this country, hospitals all across this country, diagnostic procedures all over this country. The promise of access, when access is delayed, that's care denied. And that's what's happening right now, far too often, to the people who have served this country. We ought to be about fixing that and holding accountable those in the responsible positions and holding ourselves accountable to do what is necessary to give at least the standard of care that they could get anywhere else in the country. It's time that's the direction we should go. So I thank the President for the time, and I yield the floor.